The stapedectomy is a type of middle ear operation. So this is where you take one of the hearing bones, and it's the third one, which we call the stapes, and you remove it and you replace it with a metal prosthesis. You also have to make a very small hole in the inner ear for that prosthesis to sit into. And this just then means that your hearing bones can now move freely, because before, that hearing bone called the stapes was very hardened and thick, and that means the sound can't travel as well into that middle ear. So you put a prosthesis in to allow it to move again and hopefully improve your hearing. So with a stapedectomy, patients present with a form of hearing loss called a conductive hearing loss. There are two forms of hearing loss. This is a nerve hearing loss, which we call sensory neuronal, or you have conductive. Conductive is where the sound doesn't travel through to your inner ear, but perhaps your brain is working better and can pick up sounds better. But both result in a feeling of not being able to hear properly. You can have them at the same time, or you can just have conductive hearing loss. So the aim is to improve how the sound is traveling through the ear, and that can be why it's necessary. Because in some patients, they have a condition either genetically that can occur where the bone of the hearing called the stapes has become hardened, or it can be secondary to extensive amounts of infections called sclerosis, where the bone has become hardened and the sound can't travel through to the inner ear appropriately. And that's what we call conductive hearing loss. And the procedure called the stapedectomy aims to remove that problem and therefore restore hearing. So the procedure on the whole, when you come in and you have it's a day case procedure, the procedure itself lasts for about an hour, sometimes an hour and a half, but often you have to go to sleep or at least have sedation to have that procedure completed. So you potentially will lose more time than that. After the procedure, then you get to go home. So the recovery, we ask you to take 2 weeks off work to recover. Now, that doesn't necessarily mean that you're going to feel very unwell for the whole of that 2-week period. The most common symptom is a feeling of dizziness afterwards, and that normally settles within the first 7 to 10 days. You may also feel a little bit nauseous as well with that as well. The ear will also feel very muffled and blocked, and that's because we've lifted up the eardrum and done an operation, but also we have to protect where we've lifted the eardrum and put some dressing in there, normally a sponge that dissolves over time, and that will also make the hearing feel blocked. Very occasionally as well, you can get some taste changes, but on the whole, that's quite low, around 2%, and most people will recover that if that happens. During the 2-week period, we really want you to avoid coughs and colds, and that's partly also why it's a 2 weeks off work. So when we replace this hearing bone, it actually can work really, really well and almost restore your hearing to its baseline nerve levels. For example, if your brain is working and you have normal hearing, often it restores it to almost normal hearing. If you've got the condition where you have a hardened hearing bones on both sides, when we improve one ear, patients often feel this is a life-changing ear operation. However, if you've only got the condition in one ear and you've got a very good ear in the other side, it's never normally quite as life-changing. But people do find it easy to concentrate, particularly in background noise or noisy environments, and to lateralize sounds. So it can work really well, and to be honest, is one of the most reliable ear surgeries that we have when we're talking about hearing restoration. So after the surgery, the stapedectomy procedure, we ask that you don't lift any heavy objects, that you don't strain on the toilet to pass stool, that you don't do any heavy weightlifting, and you don't go flying for 4 weeks. The reason for this is it can move the eardrum when you increase your pressures in your body during those activities, but it also could move the implant out of the inner ear whilst it's in the healing stages. We don't want that to happen because the implant could slip and then your hearing could deteriorate. We want to try and just keep everything as steady as possible, because there's some really rare complications with this procedure where you could lose hearing completely and get really severe dizziness, which we often think is a result of an overactivity or response to the implant itself. So we want you to just stay as nice and calm. Though normal walking is absolutely fine, you can go out and about, but you do want to avoid doing lots of social events, seeing extended family, going to school, for example, because we want to avoid you picking up coughs and colds, once again, because we've opened up that inner ear to allow it to all settle down nicely.